Welcome to the Confidence Through Health podcast. My name is Jerry Snyder. As a health, wellness, and sports performance coach, my goal each week is to bring you experts to help you take control of your health and build your self-confidence. Thanks for including me today on your journey to better health. I want to say thank you to Social Media Cowboys for sponsoring this week's episode of the Confidence Through Health podcast. If you need help with a website, if you need social media needs for your business, if you need help with AdWords, SEO, all those things that you know you should be doing, but you are too busy to do or you're too confused about, they are the experts that you need in your corner. If you're interested in launching a podcast, such as mine, they help me edit my podcast and do a fantastic job making sure that all of the technical side of it is handled and we launch a nice, neat, edited podcast episode each week. So I want to thank Social Media Cowboys for their continued sponsorship of the Confidence Through Health podcast. You can find them at socialmediacowboys.com, or you can find them as well with other sponsors at confidencethroughhealth.com. So Kristin, I want to thank you for being a guest on the Confidence Through Health podcast.
Thank you so much for having me. I'm excited for the conversation.
Yeah, and one of the things I love to do is bring people information that will help them help themselves, right? And because there's so much confusion out there, but there's also like what's really helping me and what's getting me on a path where I'm stuck doing this thing that I have no control over for the rest of my life, whether it's pharmaceuticals or the wrong type of training program. So, but you were in more of a traditional healthcare space and moved into the functional, like what triggered that thought process of going, wait a minute, there might be a different way to do this?
Well, I think it's important to know my background before I even went into healthcare. I was a personal trainer. And so I always knew how important movement was. And I was so passionate about being people's cheerleader and empowering them and seeing them make a goal and crush the goal. And then I moved into the healthcare system and it was not that way at all. There was no empowering patients. There was no even providing the knowledge of how they could reverse the disease state. It was all about let's diagnose, let's figure out the right treatment, let's follow an algorithm, and then I'll see you next year. Okay, your cholesterol's come down from this medicine. Let's keep the dose the same. I'll see you next year.
Yeah.
Right? I mean, a lot of your listeners, I'm sure, have experienced the traditional healthcare model. And so my first rotation, my background's in nursing. So I'm a bachelor's of nursing, master's, and doctorate, all in the nursing field. So I function as a family nurse practitioner. And so I'll always remember my first rotation as a nurse was on the dialysis unit in the hospital, which is where people go and get their blood filtered for 4 or 5 hours because their kidneys don't work. And these rooms had no windows. It's fluorescent light. I am this personal trainer, cheerleader, super excited for this dialysis, rotation, my first time in the hospital. And I was like, wow, we are really good at sick care. These people that are really sick in the United States. And I almost felt like it was too late. And so after getting my master's and then my doctorate and finding the emergency room, I started to learn how lack of knowledge was out there, how much noise is out there. And so I really wanted to get on the other side where I could bring them information before it was too late. And we work with people that have, really significant disease states too. We work with autoimmune, we work with cancer. But my emphasis, like my reason for starting Stat Wellness was to get on the other side and, really help empower people, which is exactly what you want to do with this podcast too in your practice. So thank you for having me on here.
Of course. And so when you made that move, right, and I've talked to other people on both sides of the spectrum because it's funny, I actually train a doctor who's came to me because he was like, we shared the same family physician and that person recommended me to help this doctor on his journey because he was like, he's in his 60s. And he was like, you're going to have to close your practice in a year and a half because your health is horrible. And so it's interesting to see because he's in it and he's been doing it for years. And then I come along to help him get healthy. I'm helping him get healthy through more like functional type of things and seeing that there's still a disconnect there.
Yeah.
Right? Like, how was that for you making that transition to being like, okay, the other people that I've dealt with for years are now seeing me do other things?
Well, and I think it's interesting because you're in healthcare, but having a bachelor's, master's, and doctorate, you get virtually no nutrition,
Right.
virtually no education on exercise. And those are really foundational pillars in preventing disease. And so you come out of school and you're taught to follow algorithms. Like you can search what is the recommendation for blood pressure and figure out the right medication.
Mhm.
But that's how your brain is trained. And so for me, I was like, I can't, my mind goes to why. My mind, I'm a curious mind. And so I couldn't, when I got into my master's and I was doing my rotation in family medicine, and you have 5 minutes with a patient.
Mhm.
And, you're there longer, but, your nurse is working them up, making sure the medications are right, getting your
Sure.
vital signs. Then you come in there and you've got 5 to 7 minutes with them. And my mind, after every time I met with them, was, well, why have they had their fifth sinus infection this year? Well,
Yeah.
why is their blood pressure going up? But as soon as I start getting into their stress or their sleep, it's like, okay, my other patient has been waiting on me.
Right.
And so to me, it was just so incredibly obvious. Like there was no way I would fit in a traditional model. So I
Yeah.
know some people they get burned out and then they start to see like, am I really making an impact? I want to get on the other side. For me, it was like I started my career and immediately knew this didn't align with how my mind works. It doesn't create the environment where I can talk about movement. And so we were the nation's first to blend medicine and movement under one roof. And every bank and every investor said no because there was no proof of concept.
Yeah.
Who's doing medicine and movement under one roof?
Right.
Nobody at the
Yeah.
time in
Nobody.
2019.
Nobody.
And so I
Well,
think
and
my
very few now still.
Right, right.
Yeah.
Yeah, for sure. And we now have 7 locations, and now, investors, of course, are interested because now you have a proof of concept.
Right.
And you probably know this, but the wellness-based industry is a $1 trillion
Yeah.
industry. So,
Oh
like,
yeah.
there's a lot of noise on both sides, right?
Mhm.
There's a lot of noise in traditional medicine, there's a lot of noise in wellness and functional medicine. And that can be very frustrating to your listeners, to our patients, to clients. You wonder, like, what is the right thing for me?
Yep. Yeah. And then when you only have somebody who's and even your family physician is siloed into a specific, right? But if you get recommended to go to, say, a cardiologist or oncologist or something, then they're really siloed into this. Like, yeah, I went to med school and I did all these things, but if they're 15, 20 years into their practice, a lot of those things, they're there, they know where to go find them, but they're not the deal with this every day, right?
Right.
Um, and so they're siloed into these are the things I do. And oh, you want me to talk to your kidney doctor? Okay, I can do that, but it'll take a little while to get the communication back and forth and those types of things. Whereas when you go somewhere and everything's under one roof that you need and is looking at it from more of a preventative than
Mhm.
let's help the symptom. I, I I think that's by far a better situation to be in and to look for.
Well, and one of the things that came so obvious in the ER was people would come in on their gurney with their brown bag. And, we always refer to it as a brown bag because they're calling 911 and they're throwing off
Mhm.
their medications into this brown
Right.
bag. And
Right.
so we would line them all up and we'd input them in the chart. And so many of these medications had drug to drug interactions.
Yeah.
But unless they brought their brown bag with them to all of their practices, and if all the practices had enough time to insert, the 30 different pills
Sure.
that they're taking at what dose at what time of day, to me, it seems like this is so far fetched, but this is a lot of people's life in America. It's
Mhm.
polypharmacy.
Yeah.
And so, what happens is these medications have different drug to drug interactions. And is kind of piggybacking on the siloed piece is, again, they go back to treatment versus root cause. And so when you look at someone's health from a functional medicine lens, it's not always so simple, but sometimes the root of 5 of these specialists and all of these medications is inflammation. But nobody is helping the patient understand inflammation as a whole. Like, what are we doing with our lifestyle to impact inflammation? And I want to just put this little caveat for the listeners. I do really respect our healthcare system. I think we have
Oh,
some of
sure.
the best sick care in the world. I feel so
Mhm.
fortunate if I ever need open heart surgery or if I ever get cancer. Like, I am so fortunate to
Right.
live in the United States. So I don't think my approach is never it's not bashing the way our conventional model is set up, but it's just challenging all of us as individuals to think about our health differently, to ask
Yeah.
deeper questions, to be curious, and kind of help them help you, right?
Yeah.
Like
Right.
it's but I think that's one of the big things that I will always remember is just these brown bags and these drug to drug interactions. And my patients had no idea who was even prescribing which thing anymore. They were
Oh,
just
wow.
they
Yeah.
were just filling it every year. And like some of them weren't even going back to the person that prescribed it.
Yeah.
So, I think it's functional medicine. People get or personalized medicine, precision medicine, like it has so many different names and so
Yeah.
many different people doing it in so many different ways. But I think if you really do it the right way, it should feel simpler. It shouldn't
Mhm.
feel more noisy. And I think
Yeah.
sometimes our patients come in with these 30-page protocols that they got from other offices and 20 supplements. And I'm like, well, this kind of feels similar to my time in the emergency room with this brown bag of just throwing
Right.
everything at it.
Yeah.
So I know that's a long-winded answer, but I think,
No,
just
but
kind of
it's
setting the stage of like what kind of day and time we live in the United States.
right. Well, and I think it's a telling situation when you look at the traditional healthcare and say, okay, in the United States, we rank what number one, two, or three as far as like technology and breakthrough and all of those things, like worldwide. But outcomes, when you include the entire system, we're like like pretty far down
Mhm,
compared to where we should be if we're one, two, or three in technology.
mhm,
But if you take out the chronic issues, the outcomes jump way up
mhm,
because it is that preventative side that we seem to miss. And it's not any necessarily one person's fault currently in the system because it's the way it was set up decades ago,
mhm, mhm,
and it's just grown into this. And it's one of those, like, once the train's going down the track, it's so hard to stop it.
mhm,
But having this new avenue come in and go, okay, well, why are you on all of these things? Have you ever questioned all of these things?
mhm,
And the what is the problem?
mhm. Right,
Right?
right.
Like,
And
we're just addressing symptoms. What's the problem?
I know. And I think there's like you could look at every area in the United States and isolate out some very simple things that
Mhm.
are the problems, right?
Yeah.
Like you don't have to have everything perfect, but like we can look at nutrition and say, okay, the majority of the food we eat is heavily processed with white added sugar.
Right.
Okay, we take out added sugar. What difference would our health be, right? That's kind
Right.
of one big thing we're looking at on ingredient list.
Yeah.
You look at our stress level, right? What
Right.
if we just decided to leave our phones at the door when we got home and just took
Right.
2 hours without technology? How different would our stress levels be,
Yeah.
right? Then you look at, okay, we sit at a desk all day, we don't move. We've gotten so far out from exercise as being a foundation of our health. What if we just went for a 20-minute walk every night after dinner?
Yeah.
It's these things, like, not that it's our end goal, but these starting places can make a huge difference.
Yeah.
And it doesn't have to be perfect. It's that consistency before perfection. And I
Right.
think that's where, when I meet with patients, I just get so passionate that a lot of people have tried different things in the past, but they think they have to do these extreme things, or we don't believe that a 20-minute walk every night is going to make a difference in our health.
Right.
We don't believe going to bed a little bit earlier is going to make a difference in our health, right?
Yeah.
And I think part of what I want to do is empower people to understand why each of these things are so important, how this impacts our health, and what
Yeah.
a difference it's going to make over time. One of my
Right.
favorite quotes is little by little, little becomes a lot.
Right.
And it does make a difference. And so I think, we can look at this and pretty much identify why our health is the way it is. But I do think it's really important. The CDC, over and over again, whether people think the CDC is great or not, they have really done a lot of research to show that these chronic diseases, 80% of them are modifiable.
Yeah.
So, we do know across the board, you can look at all different organizations, that our lifestyle is the biggest thing that makes a difference when it comes to chronic disease prevention. Like genetics play a role, but it's really a much smaller piece.
Mhm.
So, how do we empower ourselves to, one, understand what's happening in our body, and
Yeah.
two, believe some simple things are going to make a big difference over time,
Right.
and
Well,
stop
and
looking for the magic bullet?
yeah, and there's a couple of things I want to talk about there because you've mentioned a couple times timing of things, right? Timing of if you're on prescriptions and the multiple and the timing that you're taking them and how that interacts. But the other piece is you mentioned that walking after dinner, and I don't know if that was intentional or not, but
Yeah.
I've heard so many things about after dinner, like eat and then go move because it
Yes.
helps with digestion. It helps with, and especially if you're eating right before you go to bed, that's like one of the worst things you can do is eat a big meal or eat the wrong kind of food. And then 10 minutes later, you're in bed laying down to go to sleep and your body's going, what do you want me to do?
Mm-hmm.
Do you want me to digest? Do you want me to go to sleep? Like, what do you want me to do? Because I can't do both.
Well, what's crazy is since STAT opened in 2019, blood sugar has been one of the most important things we've looked at. Because as we've looked at the United States and American health when it comes to the obesity epidemic, inflammation, chronic disease, the food industry, like it's pretty clear that sugar regulation is one of the biggest things. Now, what improves our blood sugar, I think, varies from person to person, right? Some people it is more stress, some people it's lack of sleep, some people it's the movement piece. But we got so much scrutiny. Like everybody's primary care was like, why do they have you wearing a continuous glucose monitor? You don't have diabetes. Their hemoglobin A1C, for the listeners, which is a 3-month average, is your blood sugar over 3 months. Your red blood cells live 120 days. So we're looking at your hemoglobin A1C or your blood sugar control over the last 3 months. I always joke that it's a diabetic's worst nightmare because you know you're going into the primary care, you eat clean the week before. We're going to see 3 months before, right? So you got to really commit to some changes for 3 months. But these patients, their A1Cs would be 5.6, which is zero point 0.1 away from being pre-diabetic.
Mm-hmm.
And I would suggest we wear a continuous glucose monitor. I'd prescribe them because at the time they weren't over the counter. So I'd prescribe them a CGM and I'd start learning what's happening with their blood sugar, with what they're eating, how they're moving, their stress levels, their sleep. And so many of them came back and was like, hey, my primary care like really thinks it's unnecessary because I don't have diabetes. And I'm like, well, why are we waiting until we have diabetes to understand our blood sugar?
Right.
So the timing after meals, like when you were talking about the timing, we've been doing this since 2019. And one of the common things we saw was a short walk. Any kind of movement after you ate brought your blood sugar back down to baseline much quicker. And there was a large study that came out and CNN picked it up, Washington Post, ABC News. Like I'm sure a lot of your listeners have heard of it, but they showed just a 2-minute walk after meals was all you needed to make a statistically significant difference in your postprandial or post-meal blood sugar. If you think about that, 2 minutes,
That's not a lot.
right. But like this belief system, we now know in science. And now there's over-the-counter continuous glucose monitors. You don't need a prescription. You can go online and buy one. We now know how important it is. But it's interesting that scrutiny, when you're trying to be preventative, it's unnecessary, right?
Yeah.
Why are we checking vitamin D? Like you don't have osteoporosis. Yeah, but they also have fatigue, depression, and they're getting sick all the time. And also vitamin D is just an important nutrient for cancer prevention, right?
Right.
And so functional medicine got this stigma that we were doing unnecessary labs, where a lot of the labs we do at STAT are very basic. Like we should know our B vitamins, our liver function, our magnesium levels, our vitamin D.
Right.
So, it's interesting because our model is very set up where we want to do the highest. I would say a lot of people are looking at the financial side of things too, right? So like for a surgeon, if people don't need surgery anymore, it's going to impact the hospital's revenue, right?
Right.
So if you send to a surgeon, we do send to surgery, but like I'm going to send to a surgeon when I feel like surgery is the right next step, right? You're not going to send to a surgeon to talk about lifestyle recommendations to prevent surgery.
Right.
So if you're a hammer, you're looking for a nail, or nail looking for a hammer, whichever way you say that saying.
Yep. Well, in like real life situation of what you described, this was a couple of months ago. I was in the physical therapy clinic getting worked on because I had some muscle tightness and issues. And so, but I'm laying on my stomach and I've got needles in my leg. Right. So I'm overhearing, and my physical therapist knows I've worked with her forever. She knows who I am. She knows what I do. She trusts what I do. Right. Well, the person on the table next to me was doing her exercises and was talking about her pain and talking about her issues. And the therapist came over and she's like checking the needles to make sure that everything's still working in the right spot and all that stuff. And I had like 10 minutes left on the timer that it was sending the current through. And she just sort of tapped me and she goes, are you hearing this? And I said, yes. But I didn't want to say anything because I'm like, I'm going to wind up turning and then like, I can't move. But she's just going on about her issues and like, and it just keeps coming back and I keep winding up in here and my doctors just doesn't know what's going on. And I keep asking this question and that question. And so finally she takes the needles out and I could turn over and she looked at me and I was like, can I ask you a question? And the lady was like, yeah. And so the therapist goes, this is Jerry. This is what he does. This is what he knows, blah, blah, blah. And she goes, oh, yeah. Okay. What? I said, has anybody ever checked your cortisol levels?
Yeah.
And she was like, no. And she said it in a way just like that, where it's like, why would nobody's ever asked me about that. I was like, your stress levels off the charts. Of course, your body keeps bringing you back in here.
Isn't it
And
crazy?
she was like, oh my gosh. And immediately she's like, where do I go do that? And I was like, it's a $47 test at this place. You can get an upgrade to get more stuff, blah, blah, blah. But I was like, nothing should be stopping you from doing this. And nothing should be stopping the doctor from doing that. Like, you come in and you've got all these things and your body's reacting to the stress level that you keep throwing at it. So of course it's going to break down.
I know. I know. And even in that space, it's like that's another massively controversial space between traditional and precision medicine. It's like, unless they have Addison's disease or Cushing's disease, nothing could be wrong with your adrenal glands or your cortisol production.
Right.
I'm like, well, we see this in labs, right? I'm checking my patient's morning cortisol and it's extremely high.
Yep.
So is that not real? Well, we did a 24-hour cortisol and it was fine over a 24-hour period. And we looked at how the brain's talking to the adrenals and it was fine. So they don't have Cushing's disease.
Right.
Well, that's great. I'm really glad my patient doesn't have Cushing's disease, but they still have a super high cortisol in the morning. They deal with anxiety. Yeah. They're tired and wired at night. They're gaining weight.
Yep.
But it's not, it's so interesting because my brain doesn't live in a black and white space. Yeah. And I feel like you almost have it on both sides in traditional medicine and functional medicine. Like, I have some peers that they never think anybody should ever take a medicine. Like it's the worst thing you could ever do. Right. And I'm like, well, that's kind of a black and white mentality. Like there is some medicines that are very life-saving. Mm-hmm. So you have it on both sides, but it's really interesting. And I just always go back to like, what serves the patient well? And it's them knowing what's happening in their body, understanding optimizing is a real thing, whether you're wherever you fall in the health, like health is not the absence of disease, right? You probably have heard that quote. I did not come up with it, but it's so true. It's, just because we don't have a disease from our primary care, it does not mean you're healthy. So if you're listening and you're exhausted and you're bloated and you're not sleeping well and you're irritated and, you're reaching for candy when you get home from work, like, I'm really happy you haven't gotten a disease yet, but you are not as healthy as you could be. And so there's nothing controversial about optimizing.
Yeah.
And
and that's what's going to lead you to having better years as you age, right? And I talk to people all the time. I'm like, it's not about being perfect, right? There is no perfect health. There's no perfect level of what it's like you said, it's about, can I get better? Can I be healthier? Right. And like, and then there's a point where, okay, well, what's enough for me is good for me and I'm good. But looking at those future years going, am I setting myself up for, I may not be sick now, but if I keep doing this stuff, if I keep eating the sugar cereals every day for breakfast and having, the coffee, which, okay, coffee's not bad, but when you put everything in it, now like it's a sugar drink. When you add those things in, you may not be sick today, but in 5 years or 10 years, what's your life going to be like? And are you going to be happy with that? And, I try to get people to always look at, and it's hard because we're in the moment and we're so many things and society's throwing so many things at us and life is tough. And if you're raising kids, it's tough. I've got teenagers, so I totally get it. Right. But looking at it going, but in 10 years, I still want to be able to do this. Well, in order to be able to do that, what do I have to do today?
Yes. And also recognizing your health does shift during different seasons of life.
Sure.
So before we started recording, we were talking about like how I used to run marathons. I have 3 young kids. I can't fit in marathon training. So like my exercise routine looks very different than it did before I have a little 8-week-old at home today. Oh, nice. He's a teeny tiny little one. But this season looks very different for me. But that doesn't mean I do nothing for my health, right? So what I did was I was like, okay, in this really crazy season of life, running a business, having 3 kids, all under 5 years old, what can I commit to for myself? Okay, Kristin, you can strength train for 12 minutes a day. You can go down to your basement, you can lift weight for 12 minutes every day.
Right.
And that was my minimum that I committed to. Would I love to drive to a gym and work out for an hour? Yes. But that's what movement used to be to me. Exercise was going to a gym for an hour. If I didn't have an hour, I didn't exercise.
Right.
And now I look back and I'm like, that is so extreme thinking that if you're in a season of life where you can't commit an hour 6 days a week, I know for a fact all of us listeners can commit to 10 minutes, 12 minutes, 7 minutes,
Oh yeah.
30
Absolutely.
minutes, right?
Mhm.
But we think it's not enough. And so we do
Yeah.
nothing and we live in this black and white space. And so I think, just recognize too, if you're in a season and you're listening and you're like, I'm not eating well, I'm not sleeping well, I'm not exercising, I'm super stressed, I'm really struggling, I'm going through a divorce, whatever it may be in life, just think about like, okay, acknowledge I'm in a hard season. What is like one simple thing I can start doing right now to just start to get myself out of this hole? You know what? I'm not going to scroll on my phone before bed and I'm going to be asleep by 10:30.
Right.
That is going to make a difference over time. Now you're going to start becoming more rested. Now you're going to start having a little bit more energy. Now the next thing. Okay. So, I know for me at least, that was a hard lesson because movement is so important to me. And I want to exercise for an hour every single day. Like I feel really good when I do.
Yeah.
But sometimes that's not what our life allows or allocates for us, or mom guilt kicks in or whatever it may be. So just remember my whole message is always, little bit is going to make a big difference over time. You just have to evaluate, how are you feeling? Where are you doing well? Where are you not? Because I'm sure you see this too with your clients, but so many of my patients, when I come in and just ask basic questions, and this question to me is so incredibly basic, but my patients just stare at me like I'm a deer in the headlights. I'll ask them like, when was the last time you were the happiest? They're so thrown off that I even asked them that
Oh
question
wow.
in a
Yeah.
medical visit. They just like
Yeah.
stare at me and they're like, wait. And they like pause.
Yeah.
I'm like, wow, I thought that was gonna be the
That's
easiest thing I asked you today.
right.
And, so we aren't paying attention to like what makes us happy, what fills us up, what energizes us, what makes us feel good digestively,
Right.
and also recognizing you're not the same as your neighbor.
Mhm.
So maybe your neighbor loves going to burn boot camp every day, but you go and then you need to come home and take a nap and you're tired all day. Well, maybe
Right.
you shouldn't do burn boot camp, but your neighbor should.
Right.
Maybe you should do some yoga and go for a walk,
Yeah.
but we compare. And so I go back to seasons of life, comparison, and really just you as a person take the time to evaluate your health versus going back to what you were talking about, like the lifespan versus the health span.
Yeah.
So it's, who cares if we live to be 95, but we're laying in a bed on oxygen,
Right.
right?
Yeah. Like nobody wants that. And I've had people that have commented that on things that I've posted is like, why would you want to live that long? Like, I want to live to like 75 and be done. And I'm like, okay, well, but because what they see is people that the majority of people that are older than that, they don't want that life. And I'm like, okay, you don't want that life. That should change what you're doing now, not say, I just want to be done, you
Right.
know?
Well, and we talk about this all the time at STAT, but like sarcopenia or muscle wasting starts at 30 years old. People think
Right.
it's a, 60, 70-year-old getting frail. It's like, no,
Yeah.
the process has started at 30.
Yeah.
So how are we maintaining muscle or losing muscle? So yeah, it's understanding you have to understand it's the same thing we think about from a business perspective, right? It's like everybody knows what they're doing. You know
Yeah.
what you do day to day. You can tell me that. You
Yep.
may tell me how you do it. Here's my systems I have in place. Here's my calendar I use. Here's my GPS I use. I know how to get from point
Right.
A to point B. But why are you doing what you're doing each day? Most
Mhm.
people are like, I have no idea why I do what I do. I just
Right.
do it, right? We're so
Yeah.
busy doing, we don't take time. And it's the same thing in business too. But take the time, set
Right.
aside some time to pay attention to how you feel. And it
And we all
shouldn't
have it.
be hard. I
We all
know.
have it. We all have the time. We will, just like you sort of said earlier, we'll say that we don't have the time. We'll make up excuses for why we don't have the time, but we all have the time to do these little things. And like you said, it doesn't take a lot, you know, a 10-minute walk, in our minds. And I think part of this may come from, because I remember when I was because I got my degree in exercise physiology, and so in the 90s, we were taught, oh, the recommendations are 3 days a week, exercise for this much, blah blah, and then it changed to like 7 days a week, an hour is the recommended, and it's like, I remember people going nuts, going like, there's no way I could do. And I'm like, well, think about it though. That's because of the nutrition you've been eating, the system where you're at. You've got to get back to where you should be able to do 3 days a week. Da, 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 right? It's not lifetimes 7 days a week for an hour. It's just you put yourself in a position, you've got to turn the car and go the other direction. And then you can get back to, okay, well, a 10-minute walk can keep me healthy.
And a lot of that also too stemmed from us sitting all day long.
Yep.
So we weren't getting that NEAT factor or the non-exercise activity thermogenesis. We were sitting all day. So it's like, yeah, you need to exercise for an hour because like that doesn't even offset the 23 hours that you sat there.
Right.
Right. So it's like, well, if we got up and moved more, if we, did some squats in between calls, if we listened to a podcast on our lunch break and went for a 30-minute walk, like if we had more movement, I think the research would look very different on what is required of us but I mean, it's like the weekend warriors, it's like they still saw benefit in working out over the weekend, but you can't out exercise bad nutrition, bad sleep, and sitting all day.
Right. Yeah. And that's a huge piece too, is the nutrition. And I know, because I've talked to doctors and of course I've seen it reported, and it's like how little nutrition they get in school. And then what people are told is, oh, if you have nutrition, go talk to your doctor. And it's like, well, we're missing the people that are trained in it. We're missing the information. And then you have people like yourself or others that and now it's becoming more like approved, if you would. But 5-10 years ago, it was like, why would you go listen to that hack? They don't know what they're going to try and get you to do all these crazy things. And when that's not what you were trying to do, it was just different, different approach, and looking at the nutrition side. And now, of course, people are becoming to see it more and more and more. And you can find maps about how people eat and the style of food that they eat and the levels of obesity and how it stays in that part of the country and that region. And movement does the same thing, but nutrition is so much bigger piece of the puzzle, because like you said, you can exercise a ton. And I see this in people that they exercise, they're quote fit, and then they have a disease show up because their nutrition's been so poor. Internally, they may not show that they've got fat on their body, but internally their systems are just haywire.
And that's where it's like, you've got to think about all the different gears, right? It's like, you've got to think about the sleep and the nutrition. And I always just like imagine like an oven where you're like constantly tweaking. And I find in my own life, when I evaluate it, I'm usually doing really well in like 3 areas and I'm usually really lacking in others. And then I have to like tweak what I'm doing. And, hey, I've been like really working a lot. I've been higher in stress. I need to turn that down a little bit. I need to go do something fun this weekend. We need to go to a comedy. Like the laughter, the fun is just as important as the sleep and the nutrition and all of these other areas. But it's hard to do all of it. And so it's just, are you evaluating kind of where am I at and what are some small tweaks I can do that are going to improve that? But I also just, one of the things too, I always like to acknowledge in this, because, a lot we know the United States is one of the most obese countries. And I always like to just like add a little caveat that it's not just a willpower thing. It's really interesting the way our world, the way the United States, like if you turn the TV on, you're getting ads for commercial, like really unhealthy food and sodas. And then you're going through a drive-through and then they're asking you for 99 cents if you want to make it bigger, right? It's like we have to constantly quiet all the noise that's brainwashing us. So you may not even realize it, but you might see a Snickers on an ad as you're walking by and your blood sugar is coming down a little bit because you didn't eat a well-balanced lunch and it spiked and it dropped. And then you see the Snicker ad and now all you can think about is a Snicker. We're really brainwashed in the United States and we're really unhealthy. And then even when we try to eat healthy, we go out to eat and we get a salad dressing. That salad dressing might have more sugar in it. And we tried, right? So just think about like the industry, the world we live in, how we have to be our accountability partners, how we have to ask the questions, how it is a more abnormal way of living in the US when it should be the opposite, right? So it's it takes a lot to get yourself out of that. And the more overweight you are, the more inflamed you are, the more inflamed you are, the more you're holding on to everything. So the more resistant you are to changes. And so, just my message to you is stay hopeful and have some also non-scale victories along the way, because you
Right.
got to get the inflammation down, you've got to get the sleep better before the weight loss is going to happen.
Yeah.
And it's not just your willpower.
Yeah. I mean, willpower has so little to do with it, really. It's the habits and creating the habits and replacing the other habits, replacing the other foods, and because your taste buds will change, you'll
Mhm.
start to enjoy different things, um, and you can get the same enjoyment, like because I've lived it myself, and you can have changes and find other things that can bring you the same joy that some of that super heavy processed food did, and you'll enjoy it more because you'll wake up the next morning without the brain fog and the food hangover and the joints that don't want to move and all of that piece of it. Like you'll
Mhm.
wake up going, hey, I actually feel better. I feel like I could take on the day.
Well, and it was funny. I went on vacation, and when I go on vacation, I usually just kind of like eat what's at the restaurants and like just really
Sure. Sure.
experience it.
Mhm.
And so I always do that. And I come back from vacation, I made this like really big salad. And I was like, I am not loving my really big salad and all these vegetables as much. I could like feel the processed food and the sugar that was
Mhm.
added in changing my taste buds in just 1 week of being out of town and kind of eating
Yeah.
whatever. And
Yeah.
thankfully, I'm in my field where I'm like, okay, well, I know it's going to get better. I just have to keep eating these whole foods and healthy food, and your body's going to crave it the same way it always does.
Right.
But that's 1 week, right? Think
Yeah.
about if you had 45 years of eating a
Mhm.
sad standard American diet, and now all of a sudden you're being told to eat like more vegetables and salad. Like you
Right.
don't have a taste for it. But what
Yeah.
is your why?
Right.
So
Yeah. And you want to find that why before the why becomes I'm coming out of the hospital from a heart attack,
desperate.
or
Yeah.
whatever, or the cancer diagnosis, and it's like, okay, you've got to clean up all of these things. you know is it easier from a motivation standpoint if you're facing that? Maybe. Because when you're not facing that and you're just like, okay, I'm trying to do this and everybody else is just eating whatever they want, and I'm the lonely person over here that's got the salad with the healthy chicken breast or whatever it is that's with it. It's like, yeah, they're eating that fried food over there. But it's not willpower so much as it is what do you desire to be,
Mhm.
and what are you focused on? Um, and you sort of go back to like when you were talking about like, okay, why do you do what you do? Like, if you're not focused on it, you're just going to wake up in 30 years and go, what did I do with my career?
I know. I know. And we have this one body and we have this one
Yep.
life, right? And that's what I go back to. It's like I will, like I always joke with my patients, like you might see me eating an unhealthy burger, but trust me, 80-90% of the time I'm eating well at home. And then I
Right.
I want to not live in, I have lived in the orthorexic space, right? So I
Right.
I know what balance looks like for me. It's different for
Yeah.
everybody.
Yeah.
But I think we have this one body and we have this one life. And what do you want out of it? When you look back, I actually did this exercise and I've spoken a lot on becoming the CEO of your life. So,
Mhm.
taking the lessons I've learned as a business owner and thinking about why are we not doing this for our own life, right? Why don't we
Yeah.
have a one-page strategic plan? Why don't
Yeah.
we have KPIs that we're tracking and quarterly goals? And why are we not clear on our mission, vision, and core values? I mean, I could spend forever
Yep.
talking about, but we
Yeah.
don't. And so, I did this exercise where we wrote out in 5 years and 10 years and 20 years, how old are we? How old are our kids? How old are our parents if they were still living?
Mhm.
What did we want for our life at that point in each of these phases?
Right.
And you start putting someone's age. For me, my
Mhm.
kids are young. So I started thinking in 15 years, feels like I'm a little bit older, but you think of a kid going from 5 to 20
Oh
and
yeah.
like how much changed. And when I look back, what kind of mom did I want to be? What kind of household did I want to create for
Right.
my child?
Right.
But we ended the exercise with writing our own obituary, which I know is really
Mhm.
morbid. But if you've never thought about writing your own obituary, there
Yeah.
is nothing more tangible than
Mhm.
looking back at your life while you have the chance to create the life you want. Right.
Right. Right.
And so I had like goosebumps. I still have goosebumps even thinking about it of
Mhm.
like, it goes so fast.
Yeah.
It
It
goes
does.
so fast.
And that's a huge, powerful exercise to do. because, one of the if you look at people that are on their deathbed and what do they, talk about missing, it's not, a specific food. It's not, a time at work. It's family. It's, I wish I would have gone on that vacation. I wish I'd have had that experience. It's those things. And so, like, if we're not including that in our daily life, then there is a piece of the puzzle we're missing
Mhm.
that's going to bring cortisol down. That's going to bring stress down, because family connections, outside of maybe your, arguments at Thanksgiving dinner, right? But family connections, like experiences, like tell me somebody that goes and looks at a sunset, whether it's at a beach setting, a mountain setting, right? Or even in the city on the top of a skyscraper, and you're like, tell me somebody that watches a sunset that doesn't have a mood change and feel better and cortisol drops. Like, it's nature in the way it is there. But if when we miss it and we just go, nope, I come home from work, I sit on the couch, I watch TV until it's dark enough outside to go to bed, we're missing that connection piece that's supposed to help us naturally balance everything.
Mhm. I know. And I look at so many of the studies of Americans' mental health because the last several years I've just like really been on this path of, I always joke, if stat wellness, when I sell it or if it ever fails or whatever ends up happening with my practice, I'm starting just the happiness project. Like, I'm just
Mm.
opening, all of my locations are just going to be about having people experience happiness, because
Right.
the happier you are, the better life decisions you make, the less burnout you get, the more you live in alignment, right? You
Mhm.
can find this all over. But I go back, and I know this is such a simple thing, but a lot of the United States happiness scores went down drastically with the smartphone invention.
Oh yeah.
And you think about like how connected we are, how reactive we have to be in our day, how people can get a hold of people whenever they want, right? Like, it's that is a source of cortisol. So if you go
Oh
back to
yeah.
like the sunsets and the sunrises and all of these experiences, you even taint those with, oh, I just got this work email and now shoot, I've got to respond to this. This is a really big
Yeah.
issue. Now
Right.
your cortisol went up even when you're looking at it. So I almost wish we could simplify our life and just hammer. A lot of people want to hammer and get rid of the scale. I want to hammer and
Right.
get rid of the smartphone.
Right.
Like,
Yeah.
it has some really positives, but it also has a lot of negatives. So, I think going back to those simple things, like what did we used to do in nature? We would
Yep.
sit there, we
Yep.
would observe it, right? What did we
Mhm.
used to do at family dinners? We talked and we enjoyed our food and we chewed and we discussed. Now, we're on tablets. And sometimes I have to bring my tablet if I'm at an important dinner with friends and, with my kids. So
Yeah.
no judgment there.
Right.
But it's a big problem of where
Yeah.
society has gone, and
Yeah.
it's stripping us of these moments.
Well, and it's flipped in the way that it should be used, right? Because, like, if
Mhm.
you're doing it 5% of the time, fine. But when it's 5% of the time is when we're not using the tablet and the smartphone at dinner, or, and when you're talking about that, the image that popped in my head was, and I'm sure everybody's seen this, because several years ago, the picture that, because it was, viral over social media, of the Pope going down a road and all the crowd and everybody's got their phone. And then there's this one little old lady that's probably 90 something. And she's just like this, like just looking
Oh.
at, no phone, no anything. Everybody else has a phone in front of their face. So they're seeing the Pope through the phone. And she's just like amazed, just taking it in with her eyes. Um, and it's such a telling, tale of where we are. And now you can go anywhere, like you go to big sporting events, and everybody's got their phone and videoing to see if they can catch that moment that happens, instead of pulling the phone away from their face and going, let me watch. And it's funny because I see this as a coach of some athletes. The parents will send me videos of the kids' races, and it's funny because at the beginning of the race, they're tuned in and everything's like perfect, and they're watching through the phone. And then towards the end of the race, especially if it's competitive, the phone will drop, the picture will drop, and it'll be somebody else, or it'll be, that somebody is sitting in front of them, because they're then focused on it and yelling at their kid. They're no longer focused at the camera. And I'm like, I don't need the video. Just tell me how they did. Like, it's helpful, but like, watch your kid, like, or have somebody else video them so you can watch your kid and experience it. Because that's the joy and dopamine, and that's where we need to get that side that balances the hormone scale, that then balances our mental and balance. I mean, and then it's just a cascade from there, right?
I know. I know. And I think that's like honestly where I talk about like you got to flip it. You've got to find your why, your purpose, why you're doing what you're doing before you even start thinking about all of these other pieces of our health. And I think that's where so many people have never asked those questions. They've never looked
Right.
at these moments. And I think so many less arguments would happen, so much better decision making would happen if you're
Yeah.
living out your alignment and
Right.
experiences. And so I think it doesn't take as much as everybody thinks to move your health forward,
Right.
right?
Right.
So just take a deep breath, give yourself breaks from technology. Don't compare yourself to others. Start taking an introspective look of how are you doing? And every single person knows an area of their life that they're really thriving and an area of their life where they're really not.
Yeah.
So what is one thing you can start doing there?
Right.
It's simple.
Yep.
But I think we live in this spot where we don't ask those questions. And that is where if I could get one message out through all of Stout Wellness and everything is like you as the patient, you know your body better than anybody else, right?
Yeah.
And one other thing, I had this podcast guest on my show and he was talking about this seems so basic, but I feel like it's in line with everything we're talking about with phones and how everything in society makes us feel and our neighbors and the competitive nature and all of the noise. But he just mentioned this thing in passing that's the easiest thing that I never thought about this way. Because a lot of people will tell you about conversations they've had and things that have really left an impact on them, right? I talked with this person, good or bad. But
Right.
what we forget is the voice that we hear the most is our own in our head
Oh yeah.
all day long, from when we wake up to when we go to bed and even in our dreams, right?
Yeah.
Are we our own encourager or are we
Right.
our own biggest critic?
Yeah.
Because when he said that, I thought about it and I was like, wow, nothing actually matters. Like if you had a 5-minute conversation with someone that made you feel really bad, but the whole rest of the day you're having a really positive conversation with yourself,
Yeah.
that's okay that I had that negative conversation. But we're
Right.
so hard on ourselves and we're so connected and we live in a noisy world and we're very
Right.
competitive.
Yep.
And, I think it's just interesting.
Yeah. Well, and we do live in our own head, and that's the only thing that we can, and it's constantly talking, right? Like constantly giving us feedback, whether it's conscious or not, like whether we actually know or not, but it's constantly feedback of what's going on or in the environment around us. And I mean, a perfect example of that is you could be anywhere in a crowded area and there's noise, right? Pick crowded restaurant, whatever. And there could be somebody 3 tables away that just says your name in conversation. It does not, they don't know you. They don't, but you'll hear your name because it's just that key word that your brain knows. Like if somebody says your name, you need to be focused. And like having the time where we just turn that off,
I know.
right? And whether it's and there's so many ways to do it, whether it's meditation or, you know, just finding prayer time or whatever you want to call that quiet time. But the first step of it is you got to leave everything else away,
Mhm.
right? And take that me time and take that, that time for you. Because if not, I know plenty of moms that get caught up in it and it's like, okay, it's no longer about me, it's about the kids, it's about the right. And you're in that situation. I know you like, because I've been there, like, and it's like, because I had to tell my wife, I'm like, no, 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 take time for you. But I can't because they need this and they need that. And then no, 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 no. I will go take time for you. It's okay. Um, because when we don't do that, we get caught up in whether it's our own belief system about ourselves or, you know, um, labeling about what we think we are, who we are, and tear all that stuff away, and you can change pretty quickly.
Well, and I love this. I'm going to do a video for Instagram that I think is hilarious of moms trying to pour from an empty cup. It's
Oh
like
yeah.
that's what we are always,
Mhm.
we're sitting there thinking we can fill up everybody's cup,
Yep.
but we have nothing in our cup, right?
Right. Yep.
But we still think we can. We're still
Yep.
going to try to.
Right.
And so, just imagine like what are the little things, and for maybe that mom and for your wife back then, maybe it was 30 minutes, like just go for a walk, get out.
Yep.
Like for me, if I just go on a nature trail and just listen to some good music, I'm a
Mhm.
different mom. And it didn't take the whole day. And I still get
Right.
to be with my kids. But that little break made a big difference.
Yeah. And it's better to take that break proactively than to be at your wit's end in an argument and being like, I just have to get away.
You're going to have a break, right? You're
Yeah.
either going to have a break for you in a positive environment, or you're going to break.
Right. Yeah.
Publicly
Exactly.
or in front of the kids. It's like, which kind of
Yep.
break do you want?
Yeah. And but it's also it's all health, it's all preventative. It's all, what are you doing ahead of time in taking the moment to say, what do I really want? Right. And in so many areas, like, and you mentioned it in a career, like, what do you want out of this, that, or the other thing that you're doing? And if it doesn't align with what is going to bring you happiness in the future, then why are you doing it? Because, your parents told you to, because you're seeing something on social media, your neighbor you've got to keep up with. Like, change the job, change the, move cities, do whatever you got to do that gets you to be like, okay, now I'm aligned and my body can feel better and I can do these health practices that are simple.
Mm-hmm.
I understand 100% they may not be easy, but you cannot tell me that taking a 2-minute walk for the majority of the population is not a simple thing to do.
Mm-hmm. Simple and
Yeah.
has a large impact,
Right.
statistically significant. I remember a really quick story that one of my patients was an attorney and all of her labs looked horrible. She was miserable. And a lot of it was she was living in misalignment. And I asked her, I was like, well, why are you still an attorney? Why don't you like do something new? And she looked at me like, because I went to school, because I paid for it. And I was like, well, I mean, law school, what? That was 3 years of your life? Like, that's a
Yeah.
lot, but like 3 years and, if you live to be 90 is not that long.
Right.
And so you want to continue this path
Mhm.
for the rest of your life because you went to school for 3 years.
Right.
And all of a sudden it was like her whole mindset changed. Like, you're giving me permission to do something different with my life. Of course. Like,
Right.
we can change. Maybe you don't need to leave law altogether. Maybe you just need to find a different job in
Right.
law
Right.
first, but the
Yep.
permission to make changes. Like, what got you to the place that you're at is not what's going to get you to the next place, right?
Right. Yep.
And who cares? Who cares if you were vegan for your whole life and you feel like you need to eat some fish and chicken and now you're like, but I'm a vegan. But if
Right.
you're fish and chicken, eat it.
Yeah. Yeah.
Flexitarian. Go back to being, like, why do we have to put ourselves in this box forever? Why are we not okay
Right.
to just, kind of change with the seasons, change with how we
Yep.
feel?
Yep.
So you have permission. You as listeners have permission to make changes.
Yep.
It's okay. You have a lot of life left. And what are you doing to move that health into a place that you want, both from your health and your life? Because this is your one body and your one life.
Yeah. And it's your one chance,
Mm-hmm.
and like, if you need to make that change, and will it be hard? Will it have bumps? Will it have unknowns? Absolutely. But, it's okay. And, it's 100% possible, and I remember when I went out on a limb to start my business, and, of course, initially you're like, okay, I'm going to start a health and wellness business, and I'm competing against all these giants and all this, like, how am I going to, but then I was like, I just need a little sliver of this gigantic puzzle. I'm not trying to get the whole thing.
Yeah.
I just need a little sliver to find and be able to do what I want to do and live the life I want to live. And now people are like, dude, do you ever work? And I'm like, oh, I mean, probably not, like, because it's just fun. It's just
It doesn't
always fun.
feel like it.
Yeah.
I know. And that's what my husband and I, we like hustle hard with our business, but we always talk about like, if we're not fulfilled and we're not finding joy in it, it's time to leave, right?
Yeah.
We work really hard, but we love it. We see the impact. It's one of our
Right.
core values is having impact. It's
Yeah.
bringing us joy. So don't think of things having to be in like balance of what the world says, but like you have to
Right.
internally stay balanced and be living
Yep.
in alignment.
Yep.
So if you're not, make the change.
Right. Well, and balance is really hard because you're going to go through, if you're living healthy, you're going to go through ups and downs throughout your day, every day, because you're supposed to.
Mm-hmm.
your hormones are going to go through it, but it's about, can I sustain that continuum without having something go too far one way or the other?
Exactly.
So tell us more about like how people can find Stat Wellness, and be in touch with you and ask questions.
Yes. So check out our website. It's statwellness.com. It's STAT wellness, and it actually stands for Strength to Achieve Total Wellness. We're also on Instagram at Stat Wellness. My page is KristinOja.com, and then I'm at Kristin Oja DMP on Instagram. But we do free 15-minute check-in. So if anybody wants to kind of figure out how they could work with us, feel free to call us, text us, book a free 15. We'd love to explain the whole process. We have memberships and a la carte, but our goal is really to help you be your own advocate, right? We just want to help be your resource and your tool along the way to help you become the best version of yourself.
Right. Well, and I completely spaced this, but one of the whole reasons why when I got connected with you and found everything and looked through Stat Wellness and all this stuff was like, as a runner, that you're doing VO2 max stuff, because that's a big thing. And people are like, oh, you can get it off your watch and you can estimate it. And I'm like, can't do that. Like, it's not the same. You can get close, but it's not going to be accurate unless you go and actually do the test. And there's so much that can be learned from that, not just for athletes, but just from a longevity standpoint, from a health standpoint, from what's coming out of it. And that you've got that I was like, oh my gosh, you're cutting edge. And so I want people to know that like, this is the real stuff when you're looking at, am I getting everything looked at? Am I getting my entire package of my body looked at to say what's going on, versus going into the more traditional primary care physician where it's your vitals, the 12 markers on a blood test that they're going to look at, and then your doctor's going to have 5 minutes to walk a conversation with you. And it's like that. That's not even close to like peeling an onion.
Well, and then the worst is when you don't feel good and you get told everything looked normal, and best of luck to you. You're like, okay, well, thank you. I'm glad everything looks normal, but I feel horrible. Right. And then sometimes the next is like, well, maybe it's depression. Here's a SSRI. And you're like, but I don't feel depressed. So, just don't settle. Don't settle for whatever doesn't feel right. Dig deeper. Don't accept normal.
Yep. Awesome. Well, thank you so much, Kristin, for being a guest.
Thank you so much. This was wonderful. And thank you guys for letting me go off on a million tangents.
Of course.
That's really what I do.
No problem. Thanks for checking out the Confidence Through Health podcast. Please subscribe, post a review, share this episode with those you love who need a little extra help with their health journey. Visit allinhealthandwellness.com to learn more about the coaching programs that I provide. All episodes are produced by the Social Media Cowboys, your source for all online marketing needs. Go to socialmediacowboys.com for more information.